we do have Ross Baker on the line, and he is with HealthSherpa, and HealthSherpa is going to be that platform that we're going to be offering you guys to do your quoting and enrolling. So please, if you have questions, comment them. We definitely want you guys confident that you have all the knowledge, all the training, all the tools that you need to be successful selling ACA. So thank you again, Ross.
Thanks so much, Adrian. Thanks so much. Great to be here. Thanks everybody for joining. My name is Ross Baker. I'm one of the senior agency account managers here at HealthSherpa. I work with agencies to make sure their agents have whatever they need to be successful in writing their ACA business. So what we'll do, we have a quick presentation here. I'll go through that, and then we might be short on time, but we'll quickly show you the actual HealthSherpa account, how you're going to set it up and get ready to write business, and then how you will quote and submit an application. So I will go ahead and get started here, and then we'll try to do questions at the end.
Awesome.
Okay.
Thank you so much.
Thank you. All right, so jumping right in, what is HealthSherpa? So essentially, healthcare.gov was designed for consumers. It's really meant for individuals to enroll in health insurance, and there's not really a compliant way for agents and brokers to manage their ACA books of business on healthcare.gov. And it isn't compliant for agents to create accounts for their clients or log into their clients' accounts. So HealthSherpa is that centralized location for you to manage your ACA book of business. You can track your clients, you could submit applications, and you get all of your document statuses and policy statuses right in one central location. We've also adapted the application to be more dynamic, and it takes about 9 minutes on average versus 25 minutes on healthcare.gov. In a little snapshot of a footprint here, we did about 3.3 million enrollments. Last OE, we have 14,000 agency partners. We work with almost 50,000 unique brokers, and we do about a third of the total ACA enrollment volume. And how we do that is through something called Enhanced Direct Enrollment, or EDE. This is essentially the technology that is CMS approved, allows us to connect directly to healthcare.gov, and you can do 100% of applications, renewals, submitting documents for document matching issues, SEP verification issues, getting clients 1095A forms. All of that can happen directly on healthcare.gov without needing to be redirected back and forth with on healthsherpa.com without needing to be redirected back to healthcare.gov. The one thing about EDE is you do have to enable it. So if you're new to HealthSherpa and the ACA, when you create your HealthSherpa account, which I'll show you how to do in a second here, you're going to want to make sure you click that Enable EDE button right up at the top next to your name. This is going to take you through an identity proofing process where it will ask you questions, multiple choice questions about your personal credit history. This is to verify you are the person you are saying you are, associated with your NPN and your FFA.
I think I lost you.
Your CMS credentials, and it will sync the two accounts. So a couple quick pieces here. You could do any type of FFM enrollment, no matter how complex. We have questions built in for ICHRA, QSERA. We have off exchange health and dental options. We could do split policies where there's multiple policies within a household, Native American and Alaska Native enrollments that have additional benefits for those communities. You can report changes through the year very easily just by updating the application from your agent dashboard. Consumers also have access to the application to update those changes as well if needed. You can help clients apply for Medicaid and CHIP if you need to. Enroll via your unique marketing link, which is a consumer-facing site that allows consumers to run a quote themselves, all contained under a link that is tracked back to your agent account and your NPN. And it's really important to highlight what we can't do right now. So right now we can't do state-based enrollments. So for example, Arkansas, that is one of the state-based marketplaces. You can run quotes for state-based marketplaces, but when it comes time to enroll, you'll have to go out to the state-based marketplace site. You can't do non-ACA plans like short-term medical, anything along those lines. And we actually do have standalone dental policies, so my apologies, I need to update that slide there. Okay, a couple pieces on getting ready for open enrollment this year. I know Adrian touched on FFM certification. You want to make sure and do that. And if you do need line of authority, elder care can help you out with that as well, it sounds like. But the training is definitely something that you want to get done. I think currently CMS was planning to stop the training for like a week for, I have no idea why they would ever do that, but they kind of paused it. I've talked to some agents that are in that boat that are trying to do their training still. It sounds like they're going to open it back up within the next couple of days. They just are frantically scrambling with their tech team to get that to happen. So
Mhm.
and then if you're on there, they have the normal marketplace training. HealthSherpa also designed a training this year, and that will be eligible for certain CEUs depending on the state. Although I don't know, I don't believe Arkansas is one of those states, if that's where most of you are located.
We
But
have agents from all over on here.
awesome, awesome. So I'll send this deck out. If you follow this link, there'll be specific states. I actually did the Health Sherpa version myself this year. It seemed a lot quicker than the normal version, but maybe I'm just getting good at it. And yeah, the state licensure requirements, Adrian touched on that already. Okay, great news here. If you have any clients that have coverage through their employers, they are finally going to resolve the family glitch issue. So if you don't know what that is, if you're new to ACA, with all of these tax credits that are available, I think it's like 90% of people applying for coverage qualify for tax credits. One of the big issues people have had since the inception of the ACA back in 2013 is that they determine the affordability of employer-sponsored coverage only by looking at the cost for single coverage for the employee only. So if Adrian received an offer of coverage, but she had a spouse and 5 children that she wanted to cover, even if adding them cost her $2,000 a month, as long as it was affordable for her, she would be disqualified for all tax credits. So instead of doing just looking at the single coverage this year, starting on 11/1 for plans effective 1/1 or later, there will be kind of a double test. So if your client does have employer-sponsored coverage, it will ask you about the cost of that coverage just for them as the self-only coverage. Then it will ask them another question about what it will cost to cover their dependents. And it will be the same affordability test. Is the cost that you would pay to cover your dependents more or less than 9.12% of your tax household income? Yeah, so hopefully this gets a lot more tax credits available to people, and it also is a great selling opportunity if you have groups or networks within your network that are employees that maybe don't have great coverage available to them.
Absolutely,
Okay,
that is good news.
special enrollment period. Don't really need to touch on this. It's about over. Open enrollment starts in 4 days, but outside of open enrollment, and I have, this should be actually January 15th for this
That's what
year.
I was thinking too when I showed my slide.
Uh, they do need a qualifying life event. So loss of coverage, change in household, change in residence. There's a complete list here, but they need a qualifying life event outside of open enrollment. All right. Couple best business practices from a compliance standpoint. So this record consent one is one that CMS has been focused more and more on. So I know Adrian mentioned it's not quite as tough as Medicare when it comes to the compliance standards, but the ACA is governed by CMS still. Most of that falls to HealthSherpa, luckily, and we take care of a lot of it. The record consent is a piece that they're focusing more on. And if you're familiar with Medicare, I'd most closely associate this with it's a similar requirement to a scope of appointment. Basically, they want you to have some sort of written or audio recorded or something that says the consumer has engaged me as their client on this date in for my health
Mm-hmm. Uh-oh, I think we lost you again.
insurance agent services to shop the ACA for them. And they do want you to keep that on file for 10 years. This one's really important. Never use the consumer's contact as your contact. You don't want to put made up emails or fake emails or your emails. Always make sure it's the consumer's info in there. And then always protect your account. HealthSherpa does have two-factor authentication if you want to use that as well. All right, finally, the agent platform. So we'll go through what you need to do before you write an app, a walkthrough of the app, and then how to manage your book of business post-enrollment here. Adrian, do you want to pause and see if we have any questions right now, or?
We do have some questions, but I absolutely want to make sure that you have enough time to show us how to utilize this amazing platform.
Okay. Okay, so real quick, we'll go through. If you do not have a HealthSherpa account yet, you'll go to healthsherpa.com, click on For Agents, and then click Start Enrolling Faster. Whoops. And normally that will bring you to a workflow there to create an agent account. All you'll need is your NPN and your FFM username, and you'll end up on a dashboard like this. So this is the HealthSherpa client dashboard. You can see my first and last name right here, my NPN number, so I know it's me. This will be either your first and last name or your agency name up here. And then we have across the top here, we have some ways to begin either a quote or an application directly. We have a help tool here. What's new is a great running blog of features we've shipped, how we've updated the HealthSherpa agent account. Getting started, we'll have some short videos on using the platform similar to what I'm covering today, but a little more in depth. And then the Help Center, you can search any specific topics and you can email and call support. You'll also have a chat for support right in the bottom right-hand corner when you're in your actual HealthSherpa account. Again, over under this Gears tab, we have support. We'll hit the carriers page in a second here. If you want to convert the whole account and the quoting process to Spanish, you can do so there.
Wow.
And then if you need to review your terms or log out. Over on the left hand menu here, we have our client and lead tables or dashes. This is where you're going to see your entire book of business. and you can filter by carrier or state, specific document statuses. So if I want to see, okay, who has expired DMIs, you could see that. I guess I don't have any matches. Payment statuses, who's effectuated, any actions needed. This helps you make sure that not only you write the business, but these clients are going through the necessary steps to submit documents when necessary and pay their premiums. So we make sure that policy effectuates and everybody gets paid. And then let's see. What I want to show you real quick is if you've just set up your account or if you've had a HealthSherpa account for years, before open enrollment this time of year, you want to do the following things. You want to go over to your settings page. You want to make sure your email address is accurate. This is not only how we contact you, but it's also going to be consumer facing as well for all the clients you enroll. You're going to want to click this FFM account integration button. This will pop up a CMS login screen where you can log in with your CMS credentials and it will connect those two accounts. And then just make sure all of this info here for your name, NPN username is accurate. If you have your own agency, you can set up your own agency and invite downline agents to join you. And then if you have an upstream agency, you can join in to Elder Care Services using their join code, which of course I forgot to grab this morning, but I'll get over to Adrian after the demo here. Okay, so once you have your settings accurate, we're going to jump to the bonuses tabs real quick. And you want to decide whether or not you want to use the referral program. This is an important first step because we're going to set some logic on what happens when consumers pick certain plans that you're not appointed with and how those are handled kind of on the back end here. So the HealthSherpa referral program is really meant to fill any contracting gaps you may have. So it's you do need to be licensed in the state and you still need to be FFM certified for these FFM states. But if you are appointed with, say, Blue Cross Blue Shield of Arkansas, but not another smaller carrier, you can submit that as a referral application. We'll pay you $100 or $120 during OEP, and then all that business will be tracked down here. So if you do want to turn that on, you'll click here to indicate you agree to this joint marketing agreement that you've read thoroughly, and that will be on here. And then and I'll touch on this broker bonus piece. These are exclusive bonuses negotiated by HealthSherpa with carriers. So there'll be carrier in state or sometimes even counties within a state specific. And when it's available to you, if you've identified that you're appointed and licensed in this state and appointed with this carrier, you'll see it and you'll be able to click into it and view the actual bonus details here. And you can track all your business here. But once we've confirmed our settings and turned on the referral program, if you're going to use it, you're going to hop over to this carrier settings page. And it's really important. I always like to highlight HealthSherpa doesn't have any visibility into your state licensures and, well, I shouldn't say state licensure. It doesn't have any visibility into your appointments and contracts. So we do ping NIPR to confirm your state licensures every now and then. But if you had a state and you were appointed with certain carriers within that state, but say, okay, I don't have HealthNet or Imperial in Arizona, I'm going to set those to refer. Setting this logic now is going to determine the behavior of the quoting and application when you or a consumer select one of these plans. So if it's an appointed carrier, it's going to be a normal application. You're going to go through and you'll be able, your NPN will be associated with it. Or if they select one you have checked as a referral, you'll start a referral application right away, and it will be submitted as a referral to HealthSherpa. HealthSherpa will technically be the NPN on the app, but we're very minimally involved. We want you to maintain that client relationship, still sell other products to that client. We're really just filling the NPN AOR gap for you until you become contracted or that consumer gets back with the carrier you're appointed with. Okay, so once you set all these settings, we're ready to start a quote. I do have real quick, if you have a more complex case or you want to search the marketplace for existing ACA clients, you can use those options here. The start application will have you search the marketplace first. You'll get right into the application. This would be for if they want multiple policies within a household. Maybe they are American Indian or Alaska Natives that have additional tax credits that are going to be available to them. You'll probably want to do the application first on those more complex cases. And then if you want to search and claim here, show you how this works. Okay, so you're going to attest right here that you've received permission from this consumer to work on their behalf. You search the marketplace, and it will bring back any applications on the marketplace for this individual. So you can see here 2021, and for some reason I have 2022 existing client records in my client dash, or I could add this new instance to my clients. So if I go to view and dash here, it's going to bring me right back to my HealthSherpa account where I can see that actual client. Maybe sometimes. And this is the staging environment. So all data in here is fake. There's no PII concerns. And it's also a little slower than our actual in production environment. Okay, I don't think that's going to work today because I went through a strange path and it didn't like it. So we'll get right into running a quote here. So you click quote Onyx. Oh, actually, I do want to show you. I know Adrian mentioned OFX Medical and Dental. We do have OFX Medical and OFX Health. Both of these quoting tools are only with carriers that have integrated with HealthSherpa. So we only have select carriers in select states. I know the OFX Health, we have, I think it's about 19, maybe 18 states that have Ambetter, 17 states with Cigna, and 9 states with UHC, and then a handful of the Blues in certain areas available for OFX Medical. And OFX Dental is really just Blue Cross Blue Shield of Arizona and United One Dental for about 7 states, which include Florida, Texas, Georgia, the Carolinas, and Arizona. And so these are completely off the exchange. They're more of a direct quote and enroll tool. Pretty similar process for quoting clients and looking at plans though. So we'll just focus on the on exchange today because there's a little more to that one. Okay, so initially we'll get the client's details entered up here. We're going to enter their zip code. You can see already it's asking me, hey, it's identifying the zip code as associated with 2 counties. Which county is the right one? You'll want to confirm with the client to make sure you're quoting the right plans. Then it gets into who is applying for coverage. So we can enter a name, age, we can add a spouse here, enter their spouse. You can see that pregnant question disappears here. And a lot of that adaptability on the application is really what makes the process so quick. Okay, so we'll have 3 applicants here. It'll match that on the household members. That won't always be the case. There will be sometimes Especially we just talked about the family glitch situation. There will be some times when who is applying for coverage might not match this household members. And this is the tax household who's going to be on their taxes when they file their taxes. And it's got nothing to do with insurance coverage, but we need to know it for tax credit eligibility purposes. And then they'll enter their income. You can see if it's on the lower end here, it's going to say they're likely not eligible for marketplace plans. It's going to have a link here if you want to help the client apply for state-based Medicaid. If we go a little higher, it will show us this this family is eligible for tax credits and cost sharing reductions. So cost sharing reductions are available for people between 100 and 250% of the FPL. And what it does is essentially it lowers the out-of-pocket expenses, deductibles, copays, max out-of-pockets, and coinsurance for silver plans only. So if you ever see the CSR badge, you want to make sure to check all of the silver plans, even if the clients have low healthcare needs. Down here on the plan results section, you can see we've got the total number of plans available within the market that we're quoting. So right now we have 55. We have a health tab and a dental tab. So this dental is on exchange dental, and it can only be added to an existing client's health application at the time of the initial application. So this is really only an add-on during open enrollment or a qualifying life event outside of open enrollment. And we'll focus on the health today because the dental works almost identical to all the features here. So obviously 55 plans is a lot. I'm going to use the filters on the left-hand side to narrow this down. I can add providers here, and it's going to bring these in. Let's see. Okay, it is linked up today. We will add a provider here. And then it's going to tell us whether or not that provider is in network for the given plans. Doesn't look like they're in any network here. Oh, it is in network for Blue Cross. So if the client's like, I have to have this doctor or this facility, you can simply check that box, and it's going to narrow it down to the plans that have that provider in network. On the plan details card, you can review, you can link out to the actual formulary and provider directory from the carrier. You can view the summary of benefits and coverage, or you can dive in a little closer and look at the plan details page. This has, again, a summary of the coverage, some formal links here. This plan brochure is really helpful. This is the actual marketing brochure from the carrier. You can often find a lot of kind of additional benefits like those gym membership reimbursements, virtual care, things like that in the plan brochure. And then it's got kind of this summary of pre and post deductible estimated costs for essential health benefits down here. We'll skip that for the sake of time here. Continue on with the filters on the left-hand side. So I'm going to uncheck that provider. So all the plans come back. Same thing with prescriptions. If we have a generic prescription here, we can add it. We could add the supply duration and the dosage here and the applicant that it's applied to, and then add that in there. It will give you, if the plan does take it, it will give you an estimated cost of what that prescription would be. And we can, again, check that box to see only plans that have that on the formulary. Further down, if you have specific carriers you want to highlight, maybe Blue Cross Blue Shield has the best network, you know that. You want to highlight that to the customer, you can filter based on carrier. HSA eligibility, metal levels, really good if you have a CSR eligible client. and then networks, PPO, HMO. Once you filter, let's go ahead and filter on silver plans here. Once you filter them down, you can see we still have 23 plans. We can go ahead, right now we have the ability to switch between plan years. This would really only be used if you have a client in a special enrollment period between now and the end of November who's going to have an 11/1 or 12/1 effective date. And then we can also sort these by lowest premium, lowest deductible. We'll go lowest max out of pocket, and it's going to change the order the plans are presented. And the final tool here, probably the most popular one, is the ability to check and compare. So you can compare any plans you want to. They get added to this blue bar on the bottom, and you click compare 3 plans. It'll bring you to a nice little table. It's typically a lot easier for somebody to decide between 3 to 5 plans than 55. So this just helps narrow down the choices. You can actually send this table directly to the client. So actually, if you're there in person, you can print this table. It's going to have your agent info in the upper right-hand corner here, and then it's going to have, let me actually save this and get one of these real quick so we can see it. It's going to have all of the client's household information up there, and then you can also send this page directly to a client. So if you were sitting with a client, maybe they need to leave, they need to discuss the plans, you can click send to client. You could email this page with a link to the page directly from this pop-up, or you could just copy this link and paste it into a custom email. It's going to bring the client directly to the page that you created the link from. So if you do it from the compare page, it will send them to the compare page. If we're in on the plan details page of one of these plans and you click send to a client here, it's going to send them directly to this page. Same thing with save a lead. This is more for you as an agent. When you save a lead, you're going to enter their name, email, phone number, and it's going to save back to your lead dashboard in your agent account. And it's going to save the last page they were on. So when you click resume from your lead dashboard, it'll bring you right back to this page here. Okay, so I do want to go through and show you. So once you've gone through, you've cart on the plan selection, you simply add a plan to the and you can continue shopping. This one has dental and vision, so we'll just start the application from here. And I'm not sure what this is because this wasn't here yesterday. So, oh, this is because open enrollment has not started yet. So let me switch back to 2022 plans. So yeah, that alert I received was because I chose a 2023 plan year. The window shopping period is open where you can shop these plans, but you can't yet enroll clients in it until 11/1. So let's try this again. I will add a 2022 plan to the cart, and then I can continue shopping. I can flip over to the dental tab here, and I can just add a dental plan in and start my application. So I purposely chose Ambetter HealthNet here because this is what it's going to look like if you have a carrier selected as a referral. So it will bring you into the referral workflow. You'll attest that you're licensed in that state. If you don't want to do this, you have this carrier set as a referral carrier, and you need to go back to your carrier setting page and update it. But for now, I'm going to go get a Blue Cross plan that I know I'm appointed with here, and I'm just going to start an application. And the application again starts with searching here. And the state. And then you're confirming you've received permission from this consumer to work on their behalf. If there isn't one here, you can create a new application. It'll bring you through all of the privacy statements. You want to be sure to review these with your client, make sure they understand, and then understand the statements they're going to agree to here at the bottom. I'm going to breeze through most of this for the sake of time, though. One thing to call out here, I'm not going to provide a social security number in the staging environment, but it is highly recommended. Typically, if you don't provide a social security number, you're going to get a DMI or a data matching issue where it needs additional documents to be uploaded in order to verify the identity and citizenship of that person. So that's a good standard for the entire application. If the question is asked on the application, try to answer it to its fullest extent. This is going to limit the amount of hiccups and roadblocks we have between submitting the app and it actually effectuating. Okay, so once we have that info, we'll enter client's address. And then you'll see here, if they need a different mailing address, they just click no, and it drops down a place to enter that. They'll enter their client email. They can go paperless here, get their notices by email instead of paper copies, waiting for that to come through the mail. They'll get it instantly by the time you're done the enrollment on the phone or the meeting. And then they'll enter their phone. They can select the preferred language for the marketplace to use for all their marketplace materials and communications. And then it's going to sync that up with the marketplace here. So this is that enhanced direct enrollment technology in action, where it's just syncing on the back end directly with healthcare.gov in real time.
I do want to give you a heads up that we do have quite a few questions coming your way.
That's fine. Are you good if we go over?
Yeah, I think so. Absolutely.
Let me just make sure I'm good.
And if any agents do need to hop up, this is being recorded. So if you guys need a copy of this, we'll be happy to provide that.
Cool. Okay, all right. Hopefully this syncs up. If not, we'll just dive into the questions. But again, I think CMS is doing a lot of back-end work, getting the 2023 plans up and running, making sure the site is ready for next week. So that might be impacting the loading here. Let me actually try to go back and try to open up a client lead here that we might have filled out. Oh, so it saved that lead for me. And then I can click resume here. Okay, let's see if we can sync with the marketplace one more time here. There we go, worked that time. So it's gonna ask, you can see over on the left, we've split the application out into sections. So this is not only helpful for right now, knowing where we're at in the application, it's very helpful when you're doing any mid-year changes to the application, people change jobs, get divorced, have children. And it's very helpful doing renewals because all of this information will be pre-filled and you can just pop to a specific section that you need to update if you need to update anything on the app. So we will say they are applying for coverage. They definitely want to see if they're eligible for cost savings due to the American Rescue Plan Act. This expanded subsidies above and beyond that 400% cliff. So it used to be if you're above 400% of the FPL, you automatically were disqualified for tax credits. That is no longer. families of 3, 4, 5 can be making hundreds of thousands of dollars a year and still get almost thousands of dollars a month in tax credits, depending on the cost of coverage and how many dependents they have. So definitely always check if there's tax credits available. Okay. We'll just do a quick one here. All of this is very similar. The one thing I do want to highlight is when you're adding applicants here, you just want to make sure you click Save Person, and it will save that person here. If somebody's not applying for coverage but still in the tax household, you simply uncheck them. We'll just do these two for now. And this might be giving us problems. So I think for the sake of time here, let me see if I have anybody I can jump to that's reviewing here. Let's see what Bob Barker is doing. That's an older one.
Yeah, I'm curious about the signature options.
This plan or the signature options.
Mm-hmm.
Oh, it finally went through. Awesome. So it's going to confirm everybody lives at the following address, and it's going to ask the client questions about their tax return. Will they file one? Will it be jointly? If it's not jointly, they'll have a whole another line of questioning that'll pop up after this. And then, are there any dependents? Oops, we'll say no today. We'll just do the couple and ask if they live with anyone under the age of 19. We'll say no to both of these. Then we get into the member section. We'll enter their socials, really clean definition of what tobacco use is. It's important to identify this as it can impact the premium by up to 1.5 times if they are a tobacco user that uses 4 or more times a week in the past 6 months. We'll say no, they aren't incarcerated. Are you an American Indian or Alaska Native? This will open up additional cost sharing benefits if they are. Whoops, so I want to say no. And then we want to ask the client if they wish to identify as Hispanic, Latino, or Spanish origin, or if they wish to identify their race. They can always decline these questions if they choose to. And yeah, I apologize for the slowness today. Let me see if I can answer some questions while this loads. Multitask.
Do you want me to ask some of the questions?
Sure, yeah, if you want to throw one out.
Okay. I will try and filter through these best I can to where it's pertaining to what you're doing right now. Let me see. Stephen asked, does that include the client being able to access a proof of the insurance card with the health insurance carrier? I guess he's asking about when you send it to them via email.
So to get access to the cards, that they will not come directly through email if they select paperless. That is only for communications from the marketplace. So it's important to understand with every client you enroll, there's the marketplace and the communications from the marketplace, and then the actual insurance carrier as well. So any communications about the actual coverage and coverage details, member ID cards, that's all going to come directly from the insurance carrier. So there is a final page of my application here that I'll show you that is used for a great place to say, client and expectations. And that's where you would be able to say, depending the carriers you're working with, and if you know what that, like, say, hey, carriers will get your ID cards out in a few weeks. If that's something they have, if they need them immediately, typically you can go to your carrier back office. So you log in to say Ambetter for your agent account, and you should see that client under your clients, and you can request ID cards immediately that way if you need like a digital copy of them. Good question.
Yeah,
Hopefully I answered.
absolutely. That was a good answer. We did have a question about additional training and resources for Health Sherpa and where agents can get that.
Yeah, so those will be, I guess I do have more of this left. Those will be on this slide deck that I'll share with Adrian to distribute. So
Okay.
we've got the getting started. I can open this right now. This had some great videos on specific how to quote, navigating your dashboard, EDE, turning it on, things like that. Excuse me.
Bless you.
Oh, excuse me. I'm still getting over COVID from like 6 weeks ago. That cough just won't quit on me. Okay, we have a fraud prevention unit team that they can access as well. Agent support is more for troubleshooting, not necessarily training. But if you have a quick question about how something works or if something isn't working, you can always reach out to agent support.
Awesome. So whenever I send the in case you missed it email out, please watch for this resource as well.
I don't know if this is going to let us get through the whole application today. It's being very finicky. So let's see. Okay. So income section, very important. You can select income types. You can see all of these different income types. We'll say a job right now. And you can enter this amount as really any weekly, monthly, annual, hourly even amount if the client doesn't know how much they make a year. So let's say, we want to do a monthly of this, and then we save that as an income source here. And then it will ask us if there's any deductions. Does this income look accurate? We're going to say yes here. And then on the next page, we'll say no.
So he also asked if the enrollments are instant or do you have to wait the 24 hours?
So the enrollment is instant. The effectuation is not. So once you do an enrollment on your client dashboard here, you're going to see, you can see some of these are 11/1 effective dates. So we've got action needed for documents, and then payment also has action needed. I could refresh this to make sure it's still needed today. The payment status does need to be refreshed. You can either click that refresh button or simply click into the client. But the enrollment is instant, and you'll get the eligibility determination and all that right here.
Awesome, thank you.
All right, I think we're going to give up on the app just for the sake of everybody's time.
Okay.
I could share some of those videos in the getting started, and then let's go ahead and just jump into the questions.
Okay. Yep, we can do that. And we apologize, agents, that we're having some technical difficulties, but we will send you that video so you can watch it fully without interruption. So I'm going to go back to Joey's questions. He kind of gave me three, but he said his most important was that he's receiving emails offering to pay for my ACA clients that are aging into Medicare. He asked, can I be on the list to receive those leads? I'm assuming this has to do with Health Sherpa, but
I
maybe
don't
not.
think so.
Yeah. Maybe that's more of a question for me. The other one was, even though each carrier sends us a link to use their personal Health Sherpa, we can just use this main account to do all enrollments
Yes, yes.
kind of
So
thing.
it's important to distinguish there are carrier specific accounts, and then this is what we call our marketplace account. So the marketplace account allows you to sell all carriers available on the marketplace in given markets, in FFM markets.
Okay.
The carrier account is more um, specific to certain carriers. You can enroll directly through that carrier, but you can't quote and shop for all the available plans for a consumer. So
Right.
it's really up to you which one's going to work best. But if you want to show all the plans, you'll want to go with one of these types of accounts.
Okay. He also asked about bulk renewals and how to do that. I don't know if that has to do with Health Sherpa either.
So yes, let me see. I
I mean,
think
if it's something that is possible, we
okay.
can just.
So yeah, bulk renewals, you can go in, you can select the clients that you want to send a renewal email to and click renewal email. Oops, and they don't have any clients because it's a fake environment. Let me see if one of these does. Let me find the one
But you
client.
can do it by just selecting and sending renewal.
Yeah, essentially you're going to select these. There we go. It's going to bring you up this renewal email. You can edit the subject line. I always like to, do a call to action. I actually like to put an emoji here, for attention purposes.
That's really awesome. That's really good news for agents. If this is your first year, that's something you can look forward to next year to do a bulk renewal.
Yeah. Oh, and if you have existing ACA clients, you could bring them into Health Sherpa right now in the next few days and go through this process. It's going to save you a lot of time and open up that time to focus on new business. So,
Oh, very
um,
cool. Because we did have Tom T ask if Health Sherpa would extract their current FFM clients.
yes, that you could do that two ways. You can import clients. And let me show you one more thing on the renewal email, actually,
Okay.
real quick. You can edit this. You can also remove that button too. So if you leave this button in here, the client will click it and it will ask them to verify by either text or email that they are that person, and they'll go into the application to confirm, and it will be pre-filled with their info. If you want them to contact you and maybe go through an active renewal, this would be really probably what you want to do with like any Bright clients this year. You would hide that button and have them just respond to the email, and set up some time to shop.
Okay.
Um, you just asked about importing clients. So you can use the client import where you upload a CSV, or whenever you're meeting with a client, you simply click the search marketplace button. And this is going to grab, even if they don't have a marketplace, sorry, even if they're not on Health Sherpa, it's going to grab their marketplace app and you can pull it directly into your client dashboard. So that's more of the one at a time as you're meeting with them, or you can do a full import here on the CSV template, if you have a larger book that you need to bring over.
Okay. Awesome. I'm gonna try and go through these quickly because I mean, we have a lot of questions.
Do you have
So
a way to show them to me and I can kind of help out, or?
I don't think that
Okay,
this
no
program
worries,
lets
no
me do
worries.
that. But Lori asked, when signing up for Health Sherpa under a company name, do they have to put their agency name or elder care? And that might be something that we follow up with afterward on exactly when signing up with Health Sherpa, when you're setting up the agency, and things like that.
Yeah,
Um,
yeah,
but
that's
then Tom T asked, do we have to use the Sherpa email on the Pearl, or can we use our standard email?
I'm
And
not
then we
sure.
did have questions about if there is a Pearl, and to be clear, not everyone might not know what a Pearl is, but yes, Health Sherpa does provide you a website link for you to send people to run quotes themselves, correct?
Correct. I don't know what a Pearl is myself,
Yeah,
actually.
well, we call it a Pearl. It's a personal URL is what
Okay,
we call
okay. And so are you providing them one as well?
it. Not, I mean, they have their own through their Medicare ones through Medicare Center.
Okay, through a Medicare one. Yes, so you have something similar. So I'll hit two birds with one stone here. When you set up an agent account, you can, when you're setting up your HealthSherpa account, you can choose to set up either an agency or an agent, and you could join either of those up to Elder Care's downline. If you're just an agent account, you can still display a company name if you want to run under a specific brand. You could do that as well directly under Elder Care Services. And then you have your direct link, consumer marketing link, Pearl, whatever you want to call it. You can see here it's got your agent ID as a URL parameter here. So when somebody clicks this link, it's going to set a cookie specific to healthsherpa.com that never expires, and they will automatically be tied to your NPN. If they, this, I'll be transparent here. This almost never happens. It's probably like 10 or 12% of the time. But if somebody does get on here and completely fills out the application, it will be tied to your NPN. Or if you have in your referral settings that carrier set to referral carrier, it will be submitted as a referral on your behalf. But it's pretty standard consumer workflow. You're going to see, okay, here's my info, and eventually it will get out to the plan results page here.
Very cool. We did have Lori ask, which I think she already had to sign off, but she was trying to sign up and integrate with her FFM, and she received a note saying that the user is not assigned to the client application. So she was asking what that meant. And some of these questions I will follow up with you after the training, because I do want to make sure that I answer some of the more uh, questions that are pertaining to what we're doing.
Yeah,
Um,
anything like that, if you're like on an app with a client and you're getting an error, the best practice there is take a screenshot of the error and reach out to agent support via email or the chat right in your account. That's probably going to be the quickest, and they're going to be the most helpful. They know, any technical errors like that, they're going to know what's going on immediately.
okay,
Where
awesome.
I
And
wouldn't
we'll
have to
have
worry.
that agent support contact info for all of you as well. Um, I think you answered some of these just going through the platform. Um, you kind of mentioned at the beginning about the record consent, I think is what you called it, which is similar to the Medicare SOA. And we had an agent ask if there's a generic way to provide that proof, or is there any sort of recommended ways of getting that proof in writing? Or I'm assuming that when you check that box
We
that
don't
you have,
recommend any.
okay.
So yeah, we don't recommend any. I don't believe that box is the actual consumer consent. That's you
Okay.
more of a testing to Health Sherpa. Uh, in order to search the marketplace, you're saying, yes, I have consent from this consumer. Whether you have consent or not, that's up to you. There is a slide on here that links out to the CMS guidelines for that, that are honestly pretty vague and not that helpful, but hopefully
Okay.
they'll become more clear in the coming years here.
Okay. And that's something I can follow up with Stephen too, if there's something out there. Um, we answered that one. He asked, does Health Sherpa work with SHOP, SHOP, and
Uh,
small group health plans and CHIP?
It does check eligibility for CHIP, and you can do CHIP enrollments, but nothing to do with group insurance except for whether or not it is offered to your applicants. And if you have clients that are receiving ICHRA or QSARA through their employer, there's questions to identify that and determine exactly how that ICHRA allowance impacts tax credits. Those are really important. So
Awesome. Very good question, Stephen. Back to kind of that agent link. I want to call it a pearl. I mean, but now I guess you know what I'm talking about when I say
totally,
pearl.
yeah.
Uh, but he is asking if there's a way to link together an agency and agent, or is it their only option is they either sign up as their agency or they sign up as their agent?
So if you have an agency and you're the principal agent, when you create an agency account, it will be a fully functioning agent account. So we'll have one consumer link. If you choose to, you could have this branding over here on the left. You could update that logo to a different logo here. And then if you need to set your brand colors, you want to set a lifestyle photo, this updates the photo here. I don't recommend using a profile photo of your face here because it's a very large image, and these kind of generic stock photos for a logo or something would look
Okay.
best there.
Very cool. As a digital marketer, I love that kind of stuff. um,
Excellent.
Tom T was also just wanting to confirm the only way to import their existing FFM clients is to physically import them. There's no automatic syncing with the NPN or anything like that. Like
Uh,
as a bulk import. I mean, they can do the one at a time kind of thing, but the only bulk way is with a spreadsheet.
Only bulk way is with a spreadsheet or searching the marketplace.
Okay.
You'll learn there's anything that would fully automate is very scary to CMS. So unfortunately, all of
Yeah.
the efficient sales and marketing techniques are not really allowed at this time. But I really see Health Sherpa as kind of that liaison between, hey, this is what agents and agencies are needing and wanting to do, why they're wanting to do it, how it will benefit consumers, the end consumer, and then
Mhm.
kind of pitching that to CMS, because we have a policy team of 3 people that's talking to CMS pretty much daily this time of year, if not weekly throughout the year. So
Very cool. Well, I think that kind of ends it for the questions. So I once again want to say thank you, Ross, for taking the time to show us and our agents the Health Sherpa platform. I know that we've been offering it for years, but this is our first time to actually be able to dive deep into it and show everyone how it works. So again, appreciate you taking the time to be here this morning.
my pleasure, Adrian. Thanks so much for having me, and thanks everybody for attending. I know there's a lot going on, so get out there and sell and have a great open enrollment. And hopefully, if you do have feedback, I know Tim T had a lot of questions on what he'd like to see the product do. If you have that, don't hesitate to share that with Adrian or myself, and we'll eventually get it to the product team and try to make some changes for next year. So
Awesome. Thank you so much again. And I would like to end it by telling all of you agents that we definitely don't want you missing this opportunity. I know that most of you are all Medicare agents, but it's so important to consider offering the ACA products as well. So please follow up with us after this. We're happy to help you every step of the way getting introduced into this. And if you're already selling ACA, please consider writing that with elder care. We have the carriers, we can send you the state carrier list. When it comes to selling ACA, these products still qualify you for our shopping mall points and our lead programs. So just think about that. And we will see you all next Tuesday for the life and annuity training. Happy AEP, everyone. Have a great day.